This is the ADL/IADL assignment done by Autumn, Asia, Kayla, and Savannah. Our client for this case study is Charlie. He's a male in the first grade and his chronological age is 6 years, 9 months, and 18 days. He has mild intellectual disabilities as well as developmental delays. He has some deficiencies with executive functioning, problem solving, and also following directions. His parents' main concerns are with his feeding as well as his dressing skills. For dressing skills, he's able to put on, take off, pull on clothing like elastic waist pants or t-shirts. He can also use his Velcro strap tennis shoes, but he does have difficulty when putting socks on. His main difficulty is with fine motor tasks, so buttoning and doing zippers and that kind of stuff. Um, with feeding, he's kind of clumsy and most of the time he spills foods on himself. He also is a pretty picky eater and only likes soft foods like chicken nuggets and macaroni and cheese, as well as peanut butter and jelly sandwiches. He normally just likes soft foods, nothing with any other texture, and it may be because of bilateral jaw weakness. He can drink from a regular cup, but he is unable to pour liquid from a pitcher into a cup. The assessment done on Charlie was the Role Evaluation of Activities of Living, or the REAL, and it was completed by Charlie's parents. It assessed the child's performance and participation in his ADLs, or his activities of daily living. It didn't test any of his IADLs because he doesn't currently perform most of those. Um, his ADL raw score was a 137. Standard score was less than 84.7, which is the lowest available score, and the percentile rank was less than 1%. This indicates that he has significant delays in self care abilities compared to most of his peers around that same age range. The REAL assessment looks at a child's self care abilities either in the community, school, or at home. It is a standardized rating scale and it provides some information on ADL and IADL performance. The intended age range is 2 years to 18 years and 11 months. It also looks at body position, sequencing, can they get the supplies to do the activities, and so on. Going into reliability and validity, it has excellent test and retest reliability as well as inter-rater reliability when looking at ADL and IADL subscales. For validity, criterion validity, authors reported and compared the PD and real mean standard scores, but they were unable to determine the strength of the concurrent validity nor reported correlations. For content validity, the content validity was determined by a panel of professionals from various settings and it was found to be valid. The first intervention that we did was fine motor skills for dressing. Our preparatory techniques included coloring on a coloring sheet, as well as pinching Play Doh and trying to remove items from the Play Doh. We did this to kind of get Charlie ready for using his fingers with his fine motor skills, to get ready for doing the same motion with trying to unbutton and button the buttons. And that's basically what our intervention was, except we didn't have him button buttons on his own shirt. We had him pinch using a shirt that was stapled to a board. That way it'd be a little bit easier and he could have it out in front of him. And we also used bigger buttons to make it a little bit easier. The second intervention shown in the video was feeding and eating. We did this because Charlie's mom said that he only likes to eat soft foods like mac and cheese, chicken nuggets, and peanut butter and jelly sandwiches, and so we thought we'd incorporate that into this intervention. For the prep technique, we did blowing bubbles and making fish faces. This kind of quote unquote wakes up the face muscles and gets his mouth muscles ready to eat a harder texture like the strawberries. For the intervention, we did eating a peanut butter and jelly sandwich, and the jelly that's used is a strawberry jelly, and so we thought we'd incorporate strawberries as well. It makes it a little less daunting because it's a food that he already eats, it's just in a different form. We also thought fruit would be a good idea because the tartar of fruit is, it'll kind of make your face pucker a little bit, so that also wakes up your mouth muscles as well. There are several cultural and contextual factors that could have impacted Charlie's occupational performance. For contextual factors, Whenever he's with a babysitter, if the babysitter does not give the foods that the parents want him to eat, then that can affect like consistent mealtime routines. If the caregiver or the babysitter only gives in to what Charlie wants, like the soft foods, like the chicken nuggets, mac and cheese, or just the peanut butter and jelly sandwiches, then that can affect the progress that we're trying to make in therapy. For cultural factors, occupational performance could also be impacted by this based off of what the caregiver provides or the parent provides in the household normally. So, if the parent is only eating certain foods, then the child would probably only eat those certain foods as well and will not have a variety in their diet. Looking at the framework and theory analysis, for motor skill acquisition frame of reference, it's a process that requires practices, feedback, and involvement of the learner. It also employs several principles from the learning theory. It focuses on the child's ability, characteristics of the task, skills required, the environment, and the regulatory conditions. The interventions consist of the OT acting as a facilitator who structures learning situations to promote the child's ability to perform the tasks. When looking at motor learning theory, this has a lot to do with part task training, whole task training, and problem solving. So, especially with the fine motor activities, part task training would probably be a lot better for Charlie, especially when working on buttoning shirt buttons. The Occupational Therapy Practice Framework, or the OTPF4, aims to describe and build mutual understanding on the central concepts, basic assumptions, and vision of occupational therapy practice. The main two sections are the domain and process. For the OT intervention model processing, it's a model that guides therapists to use the top down, client centered, and occupational based approaches to assessment and intervention. Top down approach works a lot with these kind of clients, and it helps a lot when planning interventions. It begins with a patient referral and interview, along with evaluation and performance analysis, and then it's followed by client centered intervention and reevaluation. With talking about grading and adapting, we did a lot of grading down as well as adapting the task for Charlie. But for future interventions, we could grade them up to have him progress more. For grading up, we could use smaller buttons and smaller materials in the Play Doh during the preparatory activity, and it would make it harder to grasp. We would also allow Charlie to complete more steps in the task independently before assisting him. For example, in the video, we showed that he really had trouble trying to undo the button by himself, so we did it halfway and then let him finish it. But for grading up, we would just try to let him do it more independently and not assist him in any way. For feeding, we would reward him less often with his peanut butter sandwich and see if he can eat more of the food independently. In grading down, we allowed for the therapist to scaffold the task of dressing to make it easier. So in the video, we started the buttoning and then asked him to finish it. In addition, we would also utilize a sequencing schedule to help guide him through the steps of the task. For adaptations, to adapt the dressing task, we use bigger buttons to make it easier for him to manipulate, and we also use a dressing board instead of having him dress using one of his own shirts where he couldn't see it as well. To monitor Charlie's progress throughout therapy, during the interventions, the client's progress will be monitored and documented to determine if he's moving towards his goals. In each session, proper grading or adapting will be utilized. This will be noted for further progression of his skills. There will be consistent communication between the caregiver and the therapist to determine how the client is progressing in his environment. The client will also be reevaluated in 3 months using the real assessment again. And here's a list of our references that were utilized throughout the presentation.